when we get to epidemic control of the first wave, which is our collective objective and our goal, you have to have sensitive laboratory testing. You have to have good testing systems so that you can detect any reigniting, if you like, and the sparks and clusters reoccurring. So for sure, ramping up our capacity in anticipation of that period of time where we have to detect further chains of transmission is very critical. So we are doing this in a number of ways. One is every single day looking at every avenue to increase our capacity to do the detection for the virus, which is mainly the PCR test. So those are the tests that could be done in bigger laboratories, but also smaller ones. But then the rapid test that can detect the virus as well. So absolutely pursuing that, including, of course, domestic supplies such as the Spartan company that is providing, this is one that Health Canada had recently approved. So trying to get as much of that diagnostic on board. And that would be really a sort of great component of our strategy for those who are more in the remote and rural areas, indigenous communities, because that will eliminate the transportation time for any specimens. But for sure, any of those types of tests we're pursuing. Also then, of course, we are examining the antibody tests. And people have asked us that, about that in the past. And we are actively testing some of those kits, doing quality assurance, making sure that they can actually detect antibodies, and then further understanding the immunology of the virus. So I think all of those streams of capacity building are relevant.